physicians are working as hard as they can, nurses are working as hard as they can to get people the care that they need. The thing that's missing is a neutral, objective, unbiased navigation service to help target people and gain access to those who are going to be best for them.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We're pleased to have Leslie Michelson. He's the Chairman and CEO of Private Health Management and also the author of New York Times bestseller, The Patient's Playbook. Welcome to the podcast, Leslie.
Thank you so much. It's my privilege.
So, Leslie, I've read your book, The Patient's Playbook, and I think the name says it all. You've been well received on Good Morning America, CNN, Fox, and other major media outlets, so there's way too much to cover in the short amount of time we have today. So, Leslie, let's start first with the company you founded 11 years ago, Private Health Management, and that will lead us into the background for your book.
Sure. Well, thank you so much. So I started Private Health Management, as you mentioned, 11 years ago to help people navigate the healthcare delivery system and make sure they're getting the best care. One of the best news stories that's available today is over the past 25 to 30 years, there's just been an incredible explosion in biomedical research. There are far better treatments than there were years ago for almost every disease. There are better technologies to detect disease earlier when it's more readily treatable. And what all that has done is made it not only more important, but also more difficult for lay people who get diagnosed with a disease to be able to identify the preeminent experts in whatever it is they have, to get timely access to them, and to make sure that they're fully informed about all of their treatment choices so they can make more informed decisions. And we started Private Health Management to help people do precisely that.
Wow, that sounds like a pretty tall order, Leslie. 24/7 healthcare navigation. Thinking about that, I mean, that's a comprehensive coordination of your healthcare, also active care management. It seems like a very broad, very expensive service that's being provided there.
Well, what we do, frankly, is daunting. Everybody that works in the company knows that we shoulder an enormous responsibility for our clients, but we've actually figured out how to do it in a very cost-effective way, which is through employers. So it turns out, if you study the data carefully, which we do, that in every employed population, there's typically a very, very small portion of the cases that account for the lion's share of costs and opportunities for improvement. And those numbers typically run about as follows. About 1% of all of the cases represent 25% of the costs. About 10% of all of the cases represent 65% of the costs. And what we are able to do is identify those 10% of cases early on, support those people with a very comprehensive set of services, and in so doing, tackle not only the unnecessary cost issues, but also the quality problems, the long time that frequently goes between the presentation of symptoms, the obtaining of a definitive diagnosis, and putting a patient on effective treatment. So because we can distribute the cost across an entire population, the cost for the company to provide our services is actually quite modest.
Okay, so that would make sense that most of the large companies are self-insured. They're spending sometimes billions of dollars for a population of 150,000 employees or more. So this would certainly be cost-effective for them. Does this have reach out to individuals and those that aren't covered by an insurance plan by their employer? Is that part of your market as well? Kind of expand on that a little bit, if you would.
Sure. So we serve two markets. One is corporate employers who bring us in and pay us on a per member, per month basis for all their employees to provide unlimited, confidential, voluntary utilization of our services. The second market we serve is individuals, and we serve a whole lot of individuals literally across the country and around the world. And they come to us in basically two forms. One is when they've got a significant issue. Oh my gosh, I've just been diagnosed with a cancer. I've got heart disease. I've been symptomatic for a long time. Nobody knows what to do. There's been a terrible automobile or skiing accident, a developmental disorder, an addiction disorder. So we handle all of those cases. But we also serve families who bring us in and want us to be there to guide them through the healthcare system, no matter where they are, no matter what happens. So it's corporate on the one side, and individuals either have a significant issue or are generally well and want to stay that way on the other.
Okay. So I can see where becoming an educated consumer of healthcare would be pretty important, but most likely most people, they don't pay much attention to their healthcare until they need it. And when something does happen, if it's one of those tragic incidents or some type of disease they encounter, they don't know where to go. They don't know how to access the right resources. They don't know how to make good decisions. They probably don't know if they did make good decisions or feel confident about their decisions. And probably not 100% sure that all the healthcare providers are doing the right thing. I know that some of the large academic medical centers, they have more of a coherent diagnosis process now where they bring a lot of resources to the table to try to figure out early on. Is that something that you see as a leading point of interest for your company and what you do at Private Health Management?
Absolutely. So it turns out that physicians are working as hard as they can, nurses are working as hard as they can to get people the care that they need. The thing that's missing is a neutral, objective, unbiased navigation service to help target people and gain access to those who are going to be best for them. So we all know that if you want a certain level of education in math or physics, you can go to a high school. If you want it at a higher level, you can go to a community college. And if you really want to study quantum mechanics or some esoteric area of physics, you need to go to a major university. And the same is true when it comes to healthcare. If you've sprained your ankle, if you're a 9-year-old kid that's broken his arm in a football game, if you got a little asthma, if you got a little acne, if you got a cold, any of the community providers are going to be really effective and good for you. But if you've got a tough cancer, if you have an aortic dissection, if you have symptoms that no one's been able to figure out for months or years, no one's been able to give you a diagnosis, you need to escalate that to a higher level of care, typically at a major academic medical center. And people get really intimidated when it comes time to do that because they're fearful that, it's going to be more expensive. Why would they ever want to treat me? I don't even know where to start. I go on the website, there are all these names. It's just intimidating. It's not intended to be, but it's experienced that way. We don't get intimidated. We access those resources all the time for people. And it turns out there are a couple of important lessons. The first is the people at the top of the game with the major credentials are sitting there eagerly waiting for you to call. They want to treat people that are sick. And you might not be the CEO of a company. You might not be running the biggest automobile dealership in town. You might not be the major lawyer or whatever. But you are a human being, and those people want to take care of caring human beings and get them well. That's the first thing. The second thing is it does not cost any more to get the best healthcare. Now, that's a very weird proposition to put out there, but healthcare is about 18% of our entire economy today, and it is the largest sector in our economy. And one of the problems in healthcare is that there's no relationship between cost and quality. And we exploit that every single day for our clients so we can get them the highest quality without having to pay more for it. And I can take a minute and talk about that.
Yes, please do. I know that the fee-for-service model for physicians is slowly starting to change into more of a episodic and quality-based solution. It's a movement in that direction, but it's not quite there yet. So why don't you go deeper on that subject?
So here's what everybody can do. And if there's any takeaway message from this discussion, this is one that everybody should get. So, some of the highest quality physicians, not all, but some of the highest quality physicians are at the major academic medical centers that are in every one of the 20 or 30 major cities across the country. And almost all of those physicians are inpatient in almost all of the PPO networks. So if you need cancer, if you need a prostatectomy for prostate cancer, if you need to be evaluated and treated for breast cancer, if you need a stent in your heart, if you've got a tough autoimmune condition that nobody can figure out, you can find the appropriate expert at an academic medical center in your community who is likely to be in network in your insurance program. And by going to the best person, it's not going to cost you any more than going to someone else who's also in network. From your vantage point as an individual consumer, it doesn't cost you a nickel more, and it will probably cost you a lot less because that's a person who's not going to engage in excessive diagnostic tests. They're going to have the shortest path between the presentation of symptoms and the obtaining of a diagnosis, and they will put in place very quickly the treatment protocol that's likely to be the most effective for you.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
You know, one of the things that you mentioned in your book, I think you might be a football fan. You mentioned the Dallas Cowboys and how big the AT&T Stadium is. There's 80,000 fans there. And you mentioned that we've got cancer, cardiac, and preventable medical errors, the top 3 leading causes of death in this country. This preventable medical errors, we're saying hundreds of thousands of people every year could be saved through these preventable medical errors. You know, the education associated with choosing these doctors and knowing how to do that, getting a guide, if you will, is that part of the services that you offer through your company?
Absolutely. It's an essential part of the services. And within the profession of medicine, there's about 700,000 practicing physicians in the United States. There's over 5,000 hospitals. They all work very hard. They try and do their very best. But it would be preposterous to postulate that they're all equally good. It just can't be that way. Just as not every player on the Cowboys is as good as every other player, or in the NFL, or in the NBA, or every musician, or every lawyer, or every singer. There's a wide variation in every profession. And it turns out in medicine, virtually every study that's been done on the healthcare delivery system demonstrates a disturbingly high incidence of preventable medical errors that result in perhaps 400,000 people losing their lives every year in the United States. Virtually every study on the healthcare system has shown that about 30% of all healthcare is either inappropriate, unnecessary, or counterproductive. So patients need to be cautious. They need to turn on their consumer DNA. If there's any realm of your life where it makes sense to become a more effective advocate for yourself, to learn more about how to select professionals, to become more capable about making and confident about making your own decisions, it is healthcare. And that's why I wrote the Patient's Playbook, which anybody can get on Amazon or wherever they buy books today for 10 or 15 bucks. And if they can't afford it, I'll send it to them, which can make anybody a much better healthcare consumer. And on the other side of the table, I founded Private Health Management to provide a very high level of patient empowerment, education, guidance, and navigation services to people who can afford our services. So people will fall in one category or the other. They'll either be employed by a company that can afford our services, be able to afford our services on their own, or at a minimum, be able to buy my book on Amazon and get the benefit of what I've learned from 30 years of doing this.
Someone once said that they were going down the Colorado River in a raft and they had their 9-year-old daughter with them. And the question was asked, who was the most important person in that raft? And the father said, it's my daughter. And the other person said, no, it's the guide. It's the guide taking you down the river, the person that's been there and seen that and has been involved in it. So this patient's playbook, did it come before the company or as a result of having the company?
Well, that's a really good question, actually. I've been passionate about helping people become better healthcare consumers for well over 3 decades. I give a lot of speeches on this topic. I've written a lot of articles on it. It's my vocation. It's my avocation. It's who I am. It's what I do personally. It's what I do professionally. And as I was out in the community giving speeches to people, after my presentations, people would come up to me and say, this needs to be a PBS series. This is something where you need to write a book. And I started private health management in 2007 to figure out how to institutionalize this, how to do a better job, how to make it available to more people. And then after the Wall Street Journal published an article on me and my profile got escalated a little bit, I decided it was time to see if I could write the book to help people. And to my delight, all of the major publishers were interested in supporting me in doing it. And I was fortunate enough to get Knopf, the biggest and the most respected publisher in the world, to support the project. So it's something that I put a lot of time in. And I've had a couple of dreams come true with the book. I was able to get it published by the best publisher in the world. And PBS sponsored a series with me to teach people the essential lessons that are in the patient's playbook.
That's a big congratulations, too, and a huge, huge success that's helped a lot of people. So the company, looking at research and really trying to understand and investigate new drugs and devices and things of that nature, I know one of the points that you've been interested in is clinical trials. And there's a lot of people, as you mentioned, 600,000 people will die of cancer, and 5% of adults are diagnosed with cancer, participate in a clinical trial. Fewer than that actually get a clinical trial. What are your thoughts and research on that topic of clinical trials? Would you like to touch on that briefly too?
Yeah. So, as everybody who watches TV and reads the newspapers today knows, we're finally making progress in the war against cancer. The past 10 years have been utterly transformational in terms of understanding the causes of cancer, which we can now document for lots of different cancers, being able to distinguish the different types of breast cancer, lung cancer, skin cancer, prostate cancer, and being able to intervene with treatments that are both more effective than the historical treatments and have fewer side effects. In cancer, more than any other disease, some of the most effective treatments today are being studied in clinical trials that the biopharmaceutical companies sponsor to demonstrate the safety and efficacy of those treatments to obtain FDA approval. Determining whether you're a candidate for one of those clinical trials and gaining timely access to that trial can be life-saving. And it takes a lot of time and effort to figure that out. We happen to be very big believers in enrolling appropriate patients in clinical trials because we have seen firsthand the transformational result when patients get on a drug that's exactly targeted for their cancer and might have a much lower side effect profile and much greater efficacy expectations. The challenge with it is it's a pretty complicated undertaking. It needs to start with your local oncologist in an academic medical center, but patients also need to take the initiative to call clinical trial sites, to get the information they need, and to put the energy into navigating it. It's a tough battle. Unfortunately, I wish it was a lot easier, but particularly for patients with tough cancers, it can be life-saving.
I think this whole education process of becoming a consumer is best executed at the youngest age possible. Do you see any programs at all in grade schools and high schools where you can start to educate people today about what they should be concerned in terms of their health? I know in your book, The Patient's Playbook, you talk about finding the right primary care physician. I wonder how many millennials have gone out there and actually identified a primary care physician and what to avoid, some of the most common mistakes in the first 24 hours of a medical emergency. These are like life value education series that I think would just be a wonderful thing to promote at the earliest age possible. Do you see any of that taking place in the market at all, other than books like your own?
No, I see very little programmatically to train millennials, high school students, or even adults as to how to become more effective healthcare consumers. There's work that's being done on increasing economic literacy, on training people for the skills that will be necessary in the forthcoming economy rather than the economy that existed, a generation ago. It would be a better world if there were more training programs to teach people about this. And it's not that hard to do. And the lessons are things that anybody can do. If you've rented a car, if you've navigated a vacation, if you know how to summon an Uber car or get one of these delivery services to get a meal to you, you have the capability to become a much more effective healthcare consumer. And one of the tragedies of all of this is there's an enormous amount of guidance available online that is very high quality, that is neutral, that is objective, and is free. So, for example, the National Comprehensive Cancer Group, the NCCN, has a website that's free to everybody in the world. It's several clicks of a mouse. And if you, God forbid, been diagnosed with a cancer, if you go onto the NCCN website, which is a collection of 26 of the most well-respected cancer centers in the country, they have put together cancer-specific treatment guidelines so that you as an individual patient can click on your mouse, hit the print button, and get a lay-accessible 5 or 10-page printout of the treatment options for your breast cancer, your ovarian cancer, lung cancer, skin cancer, whatever it might be, that are state-of-the-art and extremely helpful so that you can walk into your physician's office and have an intelligent conversation. There are so many resources like that online that have been put together by caring, legitimate, capable organizations. Just another example. Anybody diagnosed with a disease, there is a philanthropy that is dedicated to funding treatments to do a better job for that disease. And virtually every one of those philanthropies has high quality education material available to you for free, yet very few people access it. I had the privilege some years ago of serving as the CEO of the Prostate Cancer Foundation, the world's largest philanthropy funding prostate cancer research. And one of the first things I did when I got that, terrific job is I put together a team of people to create educational material for men diagnosed with prostate cancer. And I can't begin to tell you the difference that made in the lives of so many men. So whether it's prostate cancer, pancreatic cancer, Parkinson's disease, heart disease, or diabetes, there are philanthropic resources, genuine people who've dedicated their lives to helping newly diagnosed patients or patients battling these diseases understand their treatment options and get better outcomes. I encourage everybody to take advantage of those resources.
Well, Leslie, you sound like my healthcare quarterback, and you're telling me to be an activist, get engaged, ask questions, become a real consumer of healthcare. And like they say, the best time to plant a tree is 50 years ago. The second best time is today. It's better to get planned way in advance for your healthcare needs going forward instead of having to be reactive on the backside of things. So this coaching is incredibly valuable. And I think the book that you've put forth here will be received, it has been received by a lot and will continue to be that way. So in closing, I want to thank you for your time today and see if you have any last statements you'd like to share, words of wisdom for us.
Well, I appreciate those kind comments, and I'm a much better quarterback of healthcare than I would be for the Dallas Cowboys. But what I would say to everyone, we're starting a new year here, and I guess what I would say to everyone, one of the New Year's resolutions I would encourage everybody to make is to decide to become a more effective healthcare consumer. There's very practical things that everybody can do, regardless of their income level, regardless of their education level, regardless of the status of their health. People can put together binders of their medical records. People can make sure that they've got a strong and enduring relationship with a primary care physician. People can put together contact lists and lists of the medications they're on. There's a lot of different things that people can do that can make an enormous difference in the quality of their health and their health status, not only for this entire year, but for decades to come. And it's all set out in the Patient's Playbook. It's available on our website, patientsplaybook.com, and I'm always available at Private Health to help people as well.
Excellent. We thank you very much.
And thanks to you, and best wishes for a happy and most importantly, healthy new year to you and everyone else.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.